Cambridge scientists link air pollution to dementia risk. Air pollution significantly heightens the risk of developing dementia, as revealed by groundbreaking research from scientists at the University of Cambridge. This alarming connection is drawn from the most extensive study conducted on the subject to date, highlighting a pressing public health concern that affects millions globally. Currently, dementia impacts approximately 57 million individuals around the world, and projections indicate that this figure could soar to at least 150 million cases by the year 2050. This study, spearheaded by the Medical Research Council's Epidemiology Unit at Cambridge, meticulously reviewed 51 different studies encompassing data from over 29 million participants who had been exposed to various air pollutants for a minimum of 1 year. While previous research has already identified air pollution as a potential risk factor for dementia, this comprehensive analysis establishes a clear and statistically significant link between 3 specific air pollutants and the onset of dementia. The pollutants in question include PM2.5, which originates from vehicle emissions, power plants, and wood-burning stoves; nitrogen dioxide, a byproduct of fossil fuel combustion; and soot, which is released from sources like vehicle exhaust and burning wood. These harmful pollutants, when inhaled, can infiltrate deep into the lungs, leading to a range of respiratory diseases and an elevated risk of cardiovascular issues. The study's findings are particularly striking. For every increase of 10 micrograms per cubic meter of PM2.5, the relative risk of developing dementia rises by 17%. Similarly, the risk associated with soot increases by 13% for equivalent levels. In 2023, levels of soot and PM2.5 at roadside locations in major cities such as central London, Birmingham, and Glasgow were reported to be at or above these concerning thresholds. Alzheimer's disease remains the most prevalent cause of dementia, with around 982,000 individuals in the UK currently affected. Common symptoms include memory loss, challenges with concentration, and fluctuations in mood. Dr. Haneen Kriz, the lead author of the study, emphasized that this research provides further validation of the notion that prolonged exposure to outdoor air pollution is a significant risk factor for dementia in individuals who were previously healthy. She noted, addressing air pollution can yield long-term health, social, climate, and economic advantages. It can alleviate a substantial burden on patients, families, and caregivers, while also reducing the strain on our already overburdened healthcare systems. The mechanisms by which air pollution may contribute to dementia include inducing inflammation in the brain and causing oxidative stress, a chemical process that can inflict damage on cells, proteins, and DNA. However, the researchers acknowledge limitations in their study, noting that most of the analyzed studies predominantly featured white participants from high-income countries. They advocated for future research on air pollution to include a more diverse range of participants, particularly from marginalized communities. Dr. Isolde Radford, a senior policy manager at Alzheimer's Research UK, remarked, "This thorough review adds for the growing body of evidence indicating that exposure to air pollution from vehicle emissions to wood-burning stoves heightens the risk of developing dementia. Air pollution stands out as one of the major modifiable risk factors for dementia, yet it is not an issue that individuals can tackle alone. This is where strong government leadership becomes essential." She further stated, "While the 10-year health plan recognizes the health risks posed by air pollution, much more action is required to combat this invisible menace." Alzheimer's Research UK is advocating for a bold, cross-government strategy for health prevention, one that unites various departments, including DEFRA, to collaboratively address the factors contributing to dementia risk. This pivotal report is published in the Lancet Planetary Health, underscoring the urgent need for action against air pollution and its far-reaching implications for public health. The hidden danger. How long-term exposure to air pollution increases dementia risk. Imagine waking up one day to find that the air you breathe is slowly stealing your memories, your thoughts, and your sense of self. This is the harsh reality that millions of people around the world are facing, as long-term exposure to outdoor air pollution has been linked to an increased risk of dementia. But here's where it gets alarming. A recent analysis of studies involving nearly 30 million people has shed light on the devastating role that air pollution plays in this debilitating disease. Dementia, which includes conditions like Alzheimer's disease, is expected to affect a staggering 152.8 million people worldwide by 2050, up from 57.4 million today. The impact on individuals, families, caregivers, and society as a whole is immense, and it's crucial that we understand the factors that contribute to this disease. While some studies suggest that the prevalence of dementia may be decreasing in Europe and North America, the picture is less promising in other parts of the world. Air pollution, particularly from car exhaust emissions, has recently been identified as a risk factor for dementia, but the strength of evidence has varied. To better understand this link, a team of researchers from the Medical Research Council Epidemiology Unit at the University of Cambridge conducted a systematic review and meta-analysis of existing scientific literature. By combining data from 51 studies involving over 29 million participants, mostly from high-income countries, the researchers found a statistically significant association between 3 types of air pollutants and dementia. These pollutants include particulate matter with a diameter of 2.5 microns or less, PM2.5, nitrogen dioxide, NO2, and soot. But what's striking is that for every 10 micrograms per cubic meter of PM2.5, an individual's relative risk of dementia increases by 17%. To put this into perspective, the average roadside measurement for PM2.5 in central London in 2023 was 10 micrograms per meter. Similarly, for every 10 micrograms per meter of NO2, the relative risk increases by 3%, and for each 1 microgram per meter of soot, the relative risk increases by 13%. These findings have significant implications for public health, and it's essential that we take action to reduce our exposure to these pollutants. As Dr. Haneen Kreis, senior author of the study, notes, tackling air pollution can deliver long-term health, social, climate, and economic benefits. It can reduce the immense burden on patients, families, and caregivers, while easing pressure on overstressed healthcare systems. But here's the controversy. While the study's findings are alarming, some might argue that the link between air pollution and dementia is still not fully understood. And this is the part that most people miss. The mechanisms by which air pollution causes dementia are complex and involve inflammation in the brain and oxidative stress. Air pollution can trigger these processes through direct entry to the brain or via the same mechanisms underlying lung and cardiovascular diseases. The researchers also point out that the majority of people included in the published studies were white and living in high-income countries, despite marginalized groups tending to have higher exposure to air pollution. This raises important questions about the representation of diverse populations in scientific research and the need for more inclusive studies. So, what can we do to reduce our risk of dementia and mitigate the effects of air pollution? The answer lies in a multidisciplinary approach that involves stricter limits on pollutants, targeting major contributors like the transport and industry sectors. As joint first author Claire Rogowski notes, efforts to reduce exposure to these key pollutants are likely to help reduce the burden of dementia on society. But we need to ask ourselves, are we doing enough to combat air pollution, and are we willing to make the necessary changes to protect our health and the health of future generations? The clock is ticking, and it's time for us to take action. What do you think? Should governments and industries prioritize reducing air pollution to prevent dementia, or are there other factors at play that we need to consider? Share your thoughts in the comments below. Air pollution linked to brain bleeding. New study reveals. Imagine a scenario where the air you breathe could silently increase your risk of a devastating brain bleed. That's precisely what recent research suggests about the link between air pollution and a rare but serious condition called an aneurysmal subarachnoid hemorrhage, ASAH. This type of hemorrhage can be catastrophic, potentially leaving patients paralyzed, in a coma, or even causing death. But here's where it gets controversial. New findings indicate that the connection between air pollution and ASAH might not be as straightforward as initially thought. Dr. Robert Rennard, a neurosurgeon at the University of Utah Hospital, led a comprehensive study examining 70 patients who were admitted for ASAH over 5 years. The Wasatch Front region in Utah, where these patients lived, frequently experiences high levels of fine particulate matter pollution, PM 2.5, particularly during winter inversions when pollutants get trapped in the valleys. Dr. Renard's team, including neurosurgeons from the University of California, San Diego, meticulously analyzed almost 30,000 data points to track PM 2.5 levels before each patient's admission. Initially, the researchers hypothesized that patients would show increased signs of ASASH within a week of high PM 2.5 exposure. However, their findings revealed something surprising. The incidence of aneurysmal rupture peaked 3 to 6 months after periods of peak air pollution. This temporal gap complicates the study of this relationship, making it challenging to establish a direct causal link. Despite the complexity, the significance of this research cannot be overstated. Aneurysmal subarachnoid hemorrhage carries a high risk of mortality and severe disability, emphasizing the critical need to understand its risk factors. Poor air quality in Utah's Wasatch Front has long been recognized, especially during the winter months when inversions exacerbate pollution levels. Yet the exact impact of air pollution on human health, particularly in relation to neurological conditions, remains an area of active investigation. The American Lung Association's 2024 report places the Salt Lake City-Provo-Orem area at number 25 on the list of most polluted cities in the United States for short-term PM 2.5 pollution. PM 2.5 refers to microscopic particles or droplets, about 30 times smaller than a human hair, that can penetrate deep into the lungs and bloodstream, increasing the risk of various health issues, including ischemic strokes and Alzheimer's disease. Dr. Renard sees his study as the first step in uncovering the broader implications of PM 2.5 on brain health. Future research plans include exploring whether PM 2.5 pollution can indeed cause ASASH in different regions and delving deeper into the underlying mechanisms and risks associated with air pollution and cerebrovascular diseases. Our hope is that this research will raise awareness about the public health risks of air pollution and inspire action, Dr. Renard notes. Promoting public transportation, enforcing stricter pollution limits, and investing more in environmental research can significantly reduce our exposure to harmful pollutants, leading to better health outcomes for everyone. His groundbreaking study, published in NPJ Clean Air, marks an important milestone in our understanding of the intricate relationship between air quality and brain health. As we continue to explore this connection, one thing is clear: the air we breathe matters more than ever. What do you think? Should more be done to address air pollution in your community? Share your thoughts in the comments.